Head to toe assessment. Action. This is the view around the room. Just our patient. Work table. And back to the front. Hi.
Hi.
I'm Jessica. I'm going to be doing your head to toe assessment today. We're going to start with our head. Overall, our head is normocephalic. I'm looking at our hair distribution, receding hairline, smooth texture. I don't see any lesions, nevi, masses, no infestations either. We're going to go ahead and palpate our temporal arteries. Tell me if you have any tenderness.
Oh.
Okay. And clench your jaw for me and open and close. Okay, no subluxation, no crepitus of our TMJ, and the motor portion of cranial nerve 5 is intact. We're going to go ahead and palpate our lymph nodes. We have preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, and I don't feel any palpable masses there. Looking at our face for symmetry, I'm going to have you close your eyes and point to where you feel this touch. Sensory portion of cranial nerve 5 is intact. Smile for me, frown, puff out your cheeks, pucker your lips, and raise your eyebrows. Okay, cranial nerve 7 facial is intact. We are going to go ahead and look at your ears. The outer pinna, no masses. Tragus looks fine, no lesions, no nevi, a little bit of cauliflower ear here going on, but we will take a look at our structures inside. External canal is free of cerumen. I can visualize our tympanic membrane, pearly gray, and our cone of light is at 7 o'clock. Outer pinna, free from lesions, nevi, masses, tragus is fine too, no tenderness. And I can see our tympanic membrane, pearly gray, cone of light's at 5 o'clock. Okay, I'm going to test your hearing. Tell me what word I'm saying.
Monkey. Apple.
Very good. Tell me if you hear this more so on one side than the other.
No.
Okay, we don't have any lateralization on one side or the other. And I'm going to put this on your mastoid bone. Tell me when you no longer feel the vibration.
No.
Do you hear it?
Yes.
Okay.
No.
Do you still hear
Yes.
it? Okay, air conduction is greater than bone conduction. We're going to go ahead and test our vibratory sense of our upper extremities.
Yes.
There, and our lower extremities.
Yes. Yes.
Okay, great. We are going to test your vision. So with your glasses on, I want you to cover up one eye. And can you read this line for me?
DHJBS.
And switch eyes. Can you read it backwards?
SBJHD.
Okay, we got 20/20 vision. With our glasses on, go ahead and take them off for me. Our sclera are clear, white, no icterus. Our conjunctiva are pink, no exudates. Eyebrows, eyelashes, growth pattern is normal, no crusting, anything like that. Palpebral fissures are symmetrical. So I want you to look at the door and then look at my pen. Okay, we have accommodation. Keep following. And convergence. Good. Look straight ahead for me. Straight ahead for me. We have pupillary constriction, both direct and consensual on both sides. Let's check your extraocular movement, so follow my pen. Okay, and up and down and side to side. No nystagmus. They move in tandem, so that's good. And now we're going to look at our internal eye structures. Okay. A red reflex. Red reflex. There. Great. Okay. We're going to look at our nose. I'm going to test for patency. So, yes, thank you. Just sniff for me. And the other side. Okay, patent, symmetrical, midline. Tell me if you have any tenderness of our maxillary sinus.
No.
And our frontal sinus.
No.
Okay. Our lips look fine, moist, no cracking, no peeling, anything like that. Open up for me. Say ah. Okay, soft palate and uvula rise with phonation. Tongue, no fasciculation. Our buccal mucosa is pink, moist. I don't see any cobblestoning. Dentition is in good repair. I don't see any caries. Can you lift up your tongue? Base of the tongue is free from any masses or lesions. Floor of the mouth also free from any masses or lesions. Okay, very good. We are going to palpate our carotid pulses. Okay, and they're both +3 bounding. Let's see, our trachea is midline. Thyroid, no goiter, everything looks fine there. I want you to raise your shoulders, shrug them for me. Okay, our accessory cranial nerve 11 is intact. We're going to test our range of motion of your neck, so turn both ways and flex, extend, hyperextend, and tilt side to side for me. Okay, we have good range of motion. Shoulder joints, no swelling, no redness, no masses here. I'm going to have you test your strength, so push against me with your shoulders and pull. Okay, we got 5 of 5 strength of our shoulder girdle. Raise your shoulders down. Extend your arms, depth, and rotate. Okay, we have good motion of our shoulders. Great, thank you. We're going to listen to our carotids for any bruit. No bruit. No bruit. We're going to go ahead and move on to our chest. Can you turn slightly for me? Perfect. Just to see. Okay. I am assessing our skin. We don't have any tripod positioning, no cyanosis, no evidence of respiratory distress. I want you to take a breath for me. Okay, chest expansion is symmetrical. I want you to say 99.
99. 99.
Okay, tactile primitus is even. I'm going to auscultate our lung fields. Okay. Just take breaths with your mouth open each time you feel me replace my stethoscope. Vesicular breath sounds throughout. I want you to whisper 99. And say E.
E. E. E. E. E.
Okay. No whisper, pectoriloquy, egophony, or bronchophony. So turn around to the front for me. Again, we don't have any tripod positioning, no evidence of respiratory distress. Take a breath for me. I'm also looking at our skin. We have a few nevi, nothing that looks suspicious though here. No scars that we can see, any surgeries or anything like that. We're gonna have you say 99 again.
99. 99.
Okay, tactile fermentus is symmetrical. And just take some breaths for me. Okay, and our lung fields are clear to auscultation. I'm going to go ahead and listen to our heart tones. Aortic, pulmonic, Erb's point, tricuspid, mitral, with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. Going to palpate our PMI and auscultate for a full minute. I hear S1 and S2, no adventitious sounds. I did not hear any thrills. I'm going to have you lay down. We're going to do it again. While you're laying down. Aortic, pulmonic, Erb's point, tricuspid, mitral, with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. And we don't have any heaves or lifts, and I did not auscultate any thrills this way as well. I'm going to go down ahead and listen to our aortic artery, renal arteries, iliac, and femoral. And I did not auscultate any bruits. We're going to look at our skin of our abdomen, round, no lesions, no nevi, skin is warm. I don't see any pulsations or visible masses or hernias like that. We're going to listen first. Okay. Vowel sounds are normoactive. We're going to percuss, timpani, 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 dullness in our left lower quadrant. And I'm going to palpate. Tell me if you have any tenderness.
No. 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 No.
Okay, no masses, no grimacing, so nothing to indicate that we do have anything going on there. We're going to palpate our liver. And we do not feel any hepatomegaly. We're going to palpate for our spleen. It is non-palpable, which we would expect. Okay, great. Can you go ahead and sit up for me? Actually, can you recline at 45 degrees? Just let me help you here. And turn your head, look at the wall. I don't see any jugular vein distension or pulsation. Okay, all the way back up. Sir. Okay, we're going to look at our hands. Joints, no swelling, no crepitus, no redness. I don't see any masses or anything like that. Can you flex your fingers for me? And extend, apart, thumb opposition. Okay, can you squeeze my hands? Our grip strength is 5 of 5. We're going to feel our pulses here. Radial pulses, +2 on both sides. Good. Okay, I'm going to look at our wrist joints. No swelling, no masses, no lesions, anything like that. Rotate, circle around for me. Radial deviate, ulnar deviate. Okay. Try to pull your arms up towards you, and then push. Okay, our elbow strength is 5 of 5. Our elbows, no crepitus, no masses, no lesions, anything like that. We're going to test some sensation, so close your eyes and point to where you feel this. Okay, upper extremity sensation is intact. I want to, while your eyes are closed, I'm going to put something in your hand. So tell me what this is.
Popsicle stick.
Okay, good. And this hand?
Nickel.
Okay, very good. And I'm going to draw a letter in each hand. Tell me what it is.
A.
Uh-huh.
O.
Okay, so stereognosis and graphesthesia, both good there. You can open your eyes for me now. Okay, I'm going to have you do some rapid alternating movements. So we're testing our cerebellar function here, so just pat back and forth like this and get faster and faster. Good. Touch each finger to your thumb and back again. Good, now touch your finger to your nose and then touch my finger and back to your nose and back to my finger, nose, my finger. Okay, good. Good cerebellar function there. Sensation pulses, we're going to test our deep tendon reflexes. Let's see. Brachioradialis, bicep, tricep, patellar, Achilles. Achilles, Babinski. Sorry, this side. Brachioradialis, bicep, tricep, patellar, Achilles, and Babinski. Okay, very good. I'm going to go ahead and look at our lower extremities. I'm going to tilt the camera just a little bit so we can see. Okay. Lower extremity is warm, dry, no edema, no swelling, no lesions, no masses. Knees are symmetrical, no swelling, nothing like that there. Our ankles, no swelling. They are symmetrical. We're going to test our capillary refill on our toes. It is +3. You see it here. Or less than 3 seconds. We're going to palpate our dorsalis pedis pulses. Posterior tibial. Okay, can you flex your toes for me? Flex them down and back up and spread them apart. And let's have you flex your whole foot down and back and circle around. Turn it in and rotate out. Okay, very good. Other one. I'm going to feel our pulses here. Dorsalis pedis, posterior tibial, and those are +2. Flex your toes and extend. Internal rotate, external, and circle around the ankle. Okay. Okay, very good. All right, I'm going to have you press your legs up against me. We're testing our knee strength and pull. Knee strength is 5 of 5. We're going to test our hip strength. Try to lift your legs up. Okay, good. 5 of 5 there. So go ahead and stand up for me. I'm gonna have you turn around. We're looking at our spine. We don't have any lateral deviation. I'm gonna have you bend forward. Okay, good. That's a good range of motion of our spine and no scoliosis or lordosis. Back up for me. And I'm gonna have you bend laterally both ways at the spine and rotate at your hips like this. Rotate. Good. Okay, we have good spinal range of motion. We're gonna test our hip strength, so you can turn back towards me. Okay, I want you to flex and extend back, hyperextend back behind you. And internal rotate, external rotate, okay, and circumduct. And the other one. Flex, extend, hyperextend, internal rotate, external rotate, circumduct. Okay, and walk 3 steps forward and then back. Our gait is in tandem. Very good. Put your feet together. We're going to test do the Romberg test for balance. So close your eyes. Okay, just minimal swaying. You can open your eyes for me. And hop on 1 foot. Okay, and we have good balance there. Okay. Oh, one more thing. I'm going to test our sensation of our lower extremities. So sit back down and close your eyes. Point to where you feel this. And here. Okay, good. We have good sensation of our lower extremities as well. Okay, well, we are done. You have a good day. Thank you.